Through modern advancements over the last 10-15 years, there's been a tremendous change in the way things are done. Things have come full circle with regard to some of the procedures that we do, but overall, we really focus on rehab, shorter hospital stays, and we want to have the best outcomes possible. And this is usually approached by minimally invasive surgery, being more efficient in the operative room, taking less time to do the surgery in the same manner while giving the patient an excellent result. Minimally invasive basically is a term that defines how we approach the surgery. With regard to the knee, when we talk about minimally invasive, we're using a limited incision, smaller incision. We're not cutting through all of the muscle or tendon, just a portion that's necessary or required to do the surgery. With regard to the hip, we use a complete muscle-sparing approach. This is referred to as the anterior supine intermuscular approach. What makes this approach so great is that we don't actually cut muscle. We don't cut any tendons. We spread the muscle through its natural plane and do the surgery through that plane. Benefit to the patient is minimal blood loss, shorter hospital stay, and no need for physical therapy after hip replacement. So the most common procedure performed in orthopedic surgery is arthroscopy of the knee. This procedure entails making a small incision and placing a camera into the joint. Another small incision is made and we're able to place instruments through that incision and oftentimes do a repair or removal of abnormal cartilage, abnormal pieces of bone, things that just cause what we consider mechanical symptoms in the knee. That would be popping, locking, and instability. Arthroscopy of the hip is another surgical procedure. It's less common and the indications are a little more narrow. Usually it's in more active patients. You may have seen some of the sports stars on television who receive some of these procedures, but arthroscopy of the hip can be done for a number of different reasons, including cam and pincer lesions. Those are just abnormal bone formation of both the acetabulum and the femoral neck. Labral tears, or tears of the ring of cartilage around the hip, and loose bodies. Loose bodies referring to pieces of cartilage that are floating around in the hip joint from a type of trauma. So those are usually the indications for performing arthroscopy of the hip. Again, indications are narrow. It's performed less often. However, when done in the appropriate patient, usually has a good outcome.